and preventable. Those are two words that you want to hear after a cancer diagnosis. Andrew Rosenstein is a gastroenterologist at the Cancer Institute at the University of Maryland, St. Joseph Medical Center. Thank you so much for being with us.
Thanks for having me today.
So you're here to talk about colon cancer, and when we're talking about colon cancer and using those two words, preventable and curable, that's when it's treated early, correct?
That's correct. I mean, let's start with the word preventable.
Yes.
Right, because it's colon cancer screening month, and colon cancer is truly one of the most preventable cancers that we can diagnose. And the way we do that is by getting people to come in for screening colonoscopies. Talking to your physician, assessing your risk. Do you have a family history of colon cancer? Are you having any symptoms? Those are the kind of things that prompt you to come in and get a colonoscopy. And of course, if you're the age of 50, everybody over the age of 50 is recommended to have a screening colonoscopy. So that's the preventable part of this. The curable part is that if we diagnose colon cancer early through a colonoscopy, you're much more likely to have a normal life and survive the diagnosis. So that when diagnosed early through screening, it is a very treatable form of cancer, and most people will go on to live a normal life after diagnosis and treatment.
Well, that's really important to know, because I think a lot of people are scared to get the colonoscopy to begin with. What do you tell your patients when they do have some apprehension about that?
I think, look, apprehension about any medical procedure is normal. And when I sit down and talk to people who have anxiety about this procedure, what I say is this: the bigger anxiety should be what happens if you don't get screened. Everybody has friends and family that rely on them, and you can prevent cancer and you can treat early. Come in and get your diagnosis and get treated if necessary, because ultimately, if you never get screened and you get really sick, it may be too late to be helped. So I think the bigger fear in this, and people really understand this, is that if I don't do this and I wait and I get an advanced diagnosis, I have a much less chance of surviving and getting cured. So I think people understand that, and they're able to process it and move forward.
Right. That's actually really important, because I think everyone can relate to that part of it.
Right.
It's bigger than yourself even. It's your loved ones.
Right. It's like how and I tell people that you owe it to your family to get screened, and we save a lot of lives that way, because people sometimes, if they're too anxious to do it for themselves, they're willing to do it for their loved ones.
Absolutely. And I know that colon cancer can also sometimes be asymptomatic. What should we be looking for then?
So, a lot of times, cancer can develop early and you may not be aware, but one things you should be looking for as a patient: have you had a little change in your bowel habits, maybe some increased constipation, rectal bleeding, abdominal pain? Any of those things should prompt you to get a quick referral to your physician and make sure you get a colonoscopy to rule out an early cancer. Sometimes you'll have no symptoms, but that's why we have screening programs, and that's why it's so important to know who in your family's had colon cancer, because if you have family members that have colon cancer, you're at increased risk and you may need to be screened even earlier. So know your family history, and if you develop any symptoms, immediately go to your doctor and talk to your doctor about those symptoms so they can put you in the right place and get a screening test or a diagnostic exam if necessary.
And if we are healthy right now, what can we do to keep our colon healthy?
So I think exercise actually happens to be one of the most important things about keeping your colon healthy and decreasing your risk for cancer in the future. Certainly eating a diet low in red meat and processed foods will help as well. Fresh fruits and vegetables.
And tell us about the Barbara Posner Wellness Center that you have there too.
Well, first of all, we're really excited to have the center. It gives patients an opportunity to take a holistic approach to their care, which I really think, and I think the team believes, is really incremental to the healing process for newly diagnosed cancer patients.
It really does help, and I've been there. It's a beautiful facility. You have a lot going on there. There's acupuncture, and what else is there? Yoga?
Massage, yoga, relaxation techniques, nutrition. I mean, there's just a ton of different things that really help patients get through a difficult diagnosis and help them ramp up towards the healing process. And it's been, really a blessing for our patients to incorporate that in the healing process.
Perfect. And if people want to have or get more information, they can go to the website that is on the screen there. Thank you so much for being here and shedding more light on colon cancer in general, but also how people can get treated at St. Joseph.
Thank you so much for having me today.
Of
I really
course.
appreciate it.
We will be right back with more Midday Maryland right after this. Stay tuned.